Good morning. Good to see you, man. That's what could be better than that.
Richard Cordray is the Democratic candidate for governor of Ohio. He used to run the Consumer Financial Protection Bureau. He's a technocrat, literally, which isn't usually a recipe for political success, but it's working for him, largely because of one issue.
You have experience in some of the more technical parts of government. Does that experience help with the approach to healthcare, with talking about healthcare and thinking about it?
Healthcare, like consumer finance, is a subject that can get quite complicated in its details, but on the surface and as a top-line matter is not that complicated for people. In consumer finance, where I worked, it's about people being treated fairly, people not getting cheated or mistreated. The financial system is supposed to serve everybody in our society, every consumer. And the healthcare system is supposed to serve every patient in our society, every healthcare consumer. Not that different, really.
The ACA gave millions of people with pre-existing conditions equal access to healthcare.
I think we need to make an investment in public transit. I think that should be an issue in the campaign.
It took a while for the Obamacare smoke to clear, but now it's the most popular part of the law. That's why Cordray and other Democrats are warning voters that the Republican attempts to repeal the ACA would take away the protection for people with pre-existing conditions. And Republicans suddenly get it too. That's why even though they still say they're opposed to the ACA, they're running ads like these.
Earlier this year, we learned our oldest has a rare chronic disease, a pre-existing condition.
So enough with the scare tactics. In Wisconsin, pre-existing conditions are covered.
Force insurance companies to cover pre-existing conditions.
And fighting for those with pre-existing conditions.
You and your Democratic colleagues running for office have been talking about healthcare for a long time. Republicans have evolved on the issue. Why do you think that they've changed their messaging?
You've said two things there. You've said Republicans have evolved, and you said Republicans have changed their messaging. I would agree that they've changed their messaging, but have they really evolved on this issue? I don't know that they have. You know, changing your messaging is different from actually changing your beliefs.
Cordray's Republican opponent, Mike DeWine, was late to the game, but he's now running a healthcare ad too.
Family is at the core of everything Mike DeWine does. That's why he's always protected Ohio's families. It's why he supports healthcare coverage for people with pre-existing conditions.
DeWine's ad doesn't say how he plans to protect people with pre-existing conditions. We followed DeWine on a day-long bus tour, and he talked about a bunch of things.
Our administration will focus on jobs.
But he didn't mention healthcare at all. Weird for someone who used to talk about it a lot.
I have been against Obamacare. It needs to go away. It's not working. It can't be sustained.
We wanted to ask DeWine if he has a plan to protect people with pre-existing conditions and how it would work. But he wouldn't talk to us about healthcare either.
What has your opponent said when you push him on his stance in favor of something like protecting people with pre-existing conditions and the lack of a plan to do that?
Where's the beef? I don't get any rejoinder because there is no beef there. There's no plan. He has no way of doing this. It's just a talking point for him, and that's all it is.
Is it impossible to both be in favor of repealing the Affordable Care Act and believing that people with pre-existing conditions should be protected? Is there no other way to do it?
I'm not interested in some logical exercise about what's impossible. People have been working to try to protect pre-existing conditions for years, okay? We've only ever had one law in this country that managed to do it. It's the Affordable Care Act.